Some New Zealand Post courier customers can expect slight delivery delays after 2 workers at their East Tamaki dispatch centre tested positive for COVID-19. Both employees have since moved to managed quarantine and their close work contacts have been in self-isolation awaiting test results, while all other employees at the site are being tested too. The centre has been deep cleaned and all workers are now wearing masks and are further spaced out. New Zealand Post CEO Mark Stewart says that means things are moving a little bit slower.
Over the last few days, we've had 2 confirmed cases at our Auckland Operations Centre in Highbrook in Auckland. We've reviewed the video footage and they don't appear to have come in with prolonged close contact with each other over that period. So it's unclear yet at this stage whether this was a transmission in the wider community. And as I said, there's no evidence at this stage it was within our site, but that is still to be confirmed.
That's interesting. Do they socialise together outside of work, these people?
I'm not actually aware of that, but obviously, this may be too. The Ministry of Health would confirm whether this was the same cluster, full stop, and if so, how they contracted it separately. We don't know the answer to that.
Can you just explain at the operation there? Is it a sorting room? What is it? How closely do people work together? How many people would you have in that same space?
Yeah, so this is a big warehouse operation. It's roughly the same size of 6 football fields, high ceilings, very good ventilation with big transport doors at most sides of the building. We would have roughly 300 people working there across the 24/7 operation, so typically no more than 100, 120 at one time. And as a result, an individual would typically only work closely with a small number of other people on each shift.
So this infection, we believe, has happened during the level 3 lockdown, has it?
That would be a question for the Ministry of Health and the medical experts. We don't have that information. Certainly I don't have that information to hand.
Okay, let me put it another way. Were your workers, are they always working 1 metre apart from each other currently?
So as soon as the government changed the level 3 notice, we moved immediately to 1 metre separation and face masks. Following Ministry of Health guidance, we've actually moved to 2 metres at the site until we get all our people COVID tested, which is happening at the site over the next 24 hours. So no, those are all in place as per the Ministry of Health and government alert level guidance.
So when did you move to the 2 metres apart? Was that after you got the positive tests?
Yes, it was. Really importantly, though, both cases, we're really proud of how our team members handled themselves. None of them were working when they were symptomatic. They both felt ill out of work with initially mild symptoms and immediately did the right thing, contacted the manager, didn't turn up to work and got themselves tested. So, look, a great example for all of us to stay away the second you feel any sign of sickness.
So is every single person at that worksite now being tested?
They are being tested over the next 24 hours. It's happening as we speak and will be completed tomorrow, and we're expecting the results back with urgency after that.
And do you have close contacts or employees who are having to stay at home right now at the moment? We have determined for both the cases who are the close contacts who are working for a prolonged period with the 2 people who have been contracted the virus. Of the first case, there were 3 people in that situation. Those 3 people stayed at home immediately and have thankfully come back negative from their COVID test. And the second case, there are an additional 3 people, and we're awaiting the results of their COVID testing. They are still at home and will remain at home until a period after their test comes back negative. So do you have any concerns about, transfer on surfaces of parcels or mail?
So firstly, both from our medical advice, but also the medical advice of the global postal community, there's no evidence that we can find that suggests a heightened risk of transmission across mail or parcels. So no, we don't believe so, and we would be doing things differently if that was the case. And we are tapping into global insights there as well as our own medical expertise.
So given that you're now, spacing further apart, people are wearing masks,
tasks in that work environment. What does it mean for the job you do every day? Is the mail going to be a little bit slower?
Oh, look, firstly, in terms of letter services, there's no impact to the delivery of your letter to your letterbox, so no impact there at all. That's a different facility. In terms of our courier service, typically that gets delivered very reliably overnight. That will have an extra day added to it in Auckland for the next period, and the reason for that is because of basically the loss of productivity from moving from 1 metre separation to 2 metre separation.
So, Mark, I've got to ask you, given that we're in strange times, it's a pandemic, a virus, what advice are you giving people about whether they're still, licking envelopes and things?
Oh, firstly, I think as people, it's right to be it's rightful to be a little bit anxious. I mean, we had a fantastic period where COVID was out of our community, and now it's back in. So we just like anyone else in the community, our people and ourselves are feeling a little bit anxious about things. I think that the advice would be to listen to the experts, I guess, and both in terms of the lack of transmission from mail or parcels, that is the medical advice, and also the safe operation of all our sites across Auckland and New Zealand to ensure that we're following the right medical guidelines and in doing so, doing things in a safe way.
But would you rather people used a cloth or something rather than just licking it these days?
No. As I said, there's no evidence. I mean, people can take their own decisions in mind in terms of what they do, but no, that's not the medical advice we've been given. So no, that is not a requirement that we're requesting of the public.
And that's the New Zealand Post CEO, Mark Stewart.